Welcome everyone to the annual public meeting of Epsom and St Helier University Hospitals NHS Trust. I'm Cherry McCormack, one of the non-executive directors, and representing our chairman Lawrence Newman, who can't be here this evening. Thank you all for coming this evening. It's good to see so many patients and people from across the community served by the Trust, namely Sutton, Epsom, Merton and the surrounding areas, and of course so many staff and volunteers. A few people are unable to attend and they've sent their apologies. This is a range of our local MPs, so that's Tom Brake, Stephen Hammond, Paul Burstow, Chris Grayling and Siobhan McDonough. As we did last year, we're tweeting this event live, so we might get a few questions from our 2,000 plus followers on Twitter during the question and answer session later, so hold your breath. You should all have an agenda on your seat, but basically it splits into 4 parts. First of all, we're going to focus on the big picture of the Trust. Matthew Hopkins, our CEO, will give an overview of last year and our plans and priorities for 2012-2013. He'll be followed by Krisha Algaratnam, our Director of Finance and Performance, who'll give a review of the Trust's finances. The second part will showcase the specific work done in our hospitals in 3 very different areas: the stroke service, assisted conception and intensive care. This will be followed by a question and answer session and then the final part of our meeting, which is dedicated to our charities and volunteers. Once the formal meeting is finished, please do take the time to visit the information stands in the conference rooms and chat to the volunteers and exhibitors who will be delighted to impart their knowledge to you. It really is a great opportunity to see your local NHS in action and let the enthusiasm of our exhibitors rub off on you. On that note, please can I thank the 18 hospital departments, the charities and NHS partners who've taken the time to exhibit with us tonight. 2011-2012 continued to be a challenging time for the Trust, in an environment of continued clinical and financial challenges across the NHS, and more specifically, proposed changes to the way the NHS works, including hospitals, in both London and Surrey. At some point in the future, this will impact the Epsom and St Helier NHS Trust as we know it today. It is impressive, if not unsurprising, that in these uncertain times, our staff and volunteers continue to be committed to Epsom and St Helier and go beyond the call of duty in supporting and caring for our patients and their families. I'm very proud that we're recognised in the top 21 of all hospitals in the country for the safety of our care, and that's by the Dr. Foster Hospital Guide. We couldn't start the formal part of our meeting tonight without recognising our many volunteers who, along with our staff, continue to raise money for our hospitals in a whole range of activities, the results of which directly benefit our patients, from medical equipment to improving the ward and waiting room environments. I'd also like to take this opportunity to thank a number of our key partners. The local NHS bodies with whom we work, that's NHS London, NHS South of England, NHS Surrey and NHS South West London. Secondly, our local mental health trusts, Surrey and Borders Partnership NHS Foundation Trust and South West London and St George's NHS Trust. There are our partners from the ambulance service, South East Coast and London Ambulance Services, and of course the educational organisations we work with, including St George's, University of London and Kingston University. Then there are our local GPs and the newly formed clinical commissioning groups. Links, our local involvement network groups and our local councils and MPs. And finally, our internal and external charities. I'd like to extend a thank you finally to the Trust Board, the executive team and my fellow non-executive directors. Their leadership's been key to our success over the last year and will be vital in meeting the challenges and the changes that we face. A lot of them are sitting at the front here and they'll be mingling at the end of the meeting if you haven't had a chance to meet with them already.